Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, I talk with Cass Krafasi, co-director of the Johns Hopkins Center for Gun Violence Solutions, about Measure 114 passed by Oregon voters during the midterm elections. We discuss the measure and what it took to get it over the finish line, and why it's a win not only for gun policy, but for the center, which endorsed and helped advocate for the measure. Let's listen. Cass Krafasi, thank you so much for joining us again on Public Health on Call. At midterms, Oregon's voters passed Measure 114. What is Measure 114?
So Measure 114 was a ballot initiative that had two components. So the first was a restriction on magazine capacity, so the part of the firearm that takes the bullets, and it required that magazines could hold 10 or fewer rounds. The second component was a permit to purchase system, and this would require prospective gun purchasers to first get a license, which includes a background check and safety training. So this went on to the ballot in this recent election, and those were the two components.
The Center for Gun Violence Solutions formally endorsed this measure and helped advocate for it. Why?
We've been studying permit to purchase laws for more than 10 years, and we've conducted several studies examining the impact of these laws. We've been studying permit to purchase laws for more than 10 years. We've conducted a lot of studies, several studies examining the impact of these laws on various outcomes. We look at diversions of guns for use in crime, homicide, mass shootings, and also suicide. I'm leading a new project that's funded by the CDC that's looking at these laws, permit to purchase laws, specifically on youth firearm homicide and suicide. And we're partnering with Dr. April Zeoli to look at the impacts on intimate partner homicide. The body of research that we have on these laws, these permit to purchase or PTP laws, is pretty robust. It shows that permit to purchase laws generally have substantial public safety benefits. When states put these laws into place, we see benefits and reductions in gun violence. And when states repeal these laws, we see harms in regard to public safety. We see increases in violence. Additionally, my colleague, Dr. Daniel Webster, he led a study that looked at fatal mass shootings. So it considered these permit to purchase laws. As I mentioned, we saw some reductions in those outcomes. We also looked at large capacity magazine bans in that study, and we found that in states that regulate magazine capacity, we saw both a lower incidence of fatal mass shootings and fewer people injured if a fatal mass shooting did occur. And so this measure pulled these two policies together. Our team also used a tool that we created that's called a racial equity impact assessment, and its specific focus, it is focused specifically on gun policy. And we wanted to assess whether this measure might exacerbate or mitigate existing disparities, whether there might be unintended consequences of putting this policy into place. And so pulling all of these things together, our existing research, the assessment that we did on the policy in terms of equity impacts, and we felt that this was a strong measure that could help save lives in Oregon. And so we formally endorsed it. And it was really exciting. It's the first time we've done this as a new center. We also shared data and information with our partners in Oregon, fact sheets and information. And Daniel Webster, Dr. Daniel Webster, was able to participate in a media briefing. And all of these activities together really helped gain additional support from folks in Oregon. Some large organizations came out in support. Some of the newspaper organizations came out in support, which we think was really impactful in getting this ballot initiative passed.
The ballot initiative passed by just over 30,000 votes. I think at the last count, it was like 49.1% to 50.9%. what does it say that this vote was so incredibly close?
So there's a few things to consider. When we look at public opinion polling data on these permit to purchase laws, we regularly see upwards of 75% support among U.S. adults. We also see around 60% support among gun owners. But it's important to keep in mind breadth of support, sort of how many people support a thing, doesn't always translate into depth of support, right? So people might think a policy is a good idea, but they might not be motivated enough or activated enough to take an action to support it. It's also important to remember that this ballot initiative actually had two different policies in it. So there was the permit to purchase policy, but also the large capacity magazine ban. And restrictions on magazine capacity, that's one of the few policies we studied that usually doesn't achieve majority support. So having those two pieces in one measure might have lowered support had they been sort of independent. I'll also say this ballot initiative came together really quickly. We were working with partners and anticipating that this might be on the ballot in 2024. We have some funding to do some research to inform what was going to happen in Oregon and also help with some research translation and advocacy. But in the wake of the Buffalo and Uvalde shootings, there was immense interest in doing something. And because Oregon has the ballot initiative process, they were able to gather the signatures, get it on the ballot this year. And so it came together more quickly. Maybe there wasn't the same amount of prep work to be able to do some of the translation, educating officials, educating the public on this topic. But now that it's passed, we are very excited to work with the legislature to make sure that it gets implemented effectively. The ballot initiative passed, but the legislature still has to do some work to get it ready to go. And so we're going to be working with their staff, making sure advocates on the ground have what they need as they're working towards implementation.
And just give us a brief overview of that implementation process, because you mentioned two very high profile shooting events that happened recently. And the people that were driving to get this done obviously want to see change happen sooner than later. What's the time frame that we're talking about where we might actually see some of these outcomes that you were talking about previously?
It's a really great question. So sometimes a ballot initiative says, when this passes, X amount of time has to happen. And so you might not see something going into place for a year or 2 years. This initiative said, as soon as it passes, the legislature needs to get to work and roll this out. Now, it's really important to keep in mind when you are passing new policies, putting new policies into place, it's not like a light switch. We're not suddenly going to have a law and we're going to start to immediately see reductions. Guns are durable products. There are a lot of them out there. We know that around 20% of gun sales occur through private markets that might not be regulated. So it's not like magically we will see these immediate reductions. But from some of the work we've done in places like Connecticut, for example, we know that we've seen 20 to 30% reductions in gun homicide and gun suicide in the 10 years following the passage of this law. And conversely, when states take their laws away, we actually see a much quicker impact. Within a few years, you can start to see those harmful effects because you've removed that sort of protective policy. So I would say we're going to be keeping an eye on this, both in terms of the research side, evaluating what's happening over time in Oregon, but we have folks within our center with expertise in implementation, in advocacy, and they're going to be working to make sure that policymakers have what they need to make sure that this has the right regulations, the right procedures in place, not just for identifying and screening out prohibited individuals, but making sure that it's implemented equitably. We don't want to be creating further disparities or further disenfranchising certain parts of the population. So that's going to be a really important thing that we're working on also.
Where does Measure 114 fall into the context of the recent Supreme Court ruling, which struck down a New York law about restrictions on carrying firearms?
So I'm not a lawyer. I work with extremely smart people who are lawyers, and I learn from them. But in very simple terms, the Bruen decision, the New York State decision in the Supreme Court, which we refer to as Bruen, it did two things. First, it struck down the proper cause requirement for concealed carry licensing. So New York and 7 other states had what we referred to as may issue laws. This means that applicants have to meet some strict background check criteria. They have training requirements, but then they also have to demonstrate a good and substantial reason to carry a concealed gun in public. And there were concerns about how this was being used, fairly or otherwise, and so the Supreme Court struck that provision down. The other piece of the Bruen decision, which is the more concerning piece, is that it also struck down the 2-part test that the courts had coalesced around post-Heller, the 2008 Supreme Court decision Heller that struck down Washington, D.C.'s handgun ban. Courts, in the wake of Bruen, are having to look at laws that were on the books at the time the Second and 14th Amendments were ratified. So between 1791 and the early 1800s for relevant laws, or to find historical analogs. And that's a concern because for some of our most important policies, those things were not unlawful. Thinking about domestic violence prohibitions or provisions, thinking even about large capacity magazine bans. Many of the firearms that existed at that time, you had one shot. And so thinking about restricting capacity, it might be hard to come up with some analogs, which might make it easier for folks to challenge laws, and it might make it harder for courts to uphold them. But there still is an important role for public health data to be advocating for what we need to see, to be supporting the policies that are effective and trying to keep them in place. And there are many places in the US that have had permit to purchase laws for a very long time, more than 100 years in some states. And so there is some historical precedence for these policies. So all of that is to say, it remains to be seen, but we are being mindful about what is valid and viable in the wake of Bruen.
Yeah, and in that larger context, this is a victory for gun policy, especially when it comes to solutions for gun violence. It's also a win for your center's goals to bring together research and advocacy to promote these evidence-based solutions. So let's talk a little bit about where this falls into the greater context. Could we see other states following suit with this kind of thing?
Absolutely. So around half of states in the U.S. have some kind of ballot initiative process. So in the absence of legislative action at the state level, voters in those states could pursue a ballot initiative. I would recommend one policy at a time instead of trying to do multiple things with a ballot initiative. But you know what? Sometimes you go with what you've got. But we're also working with partners in Delaware on permit to purchase legislation. We've been working with them over the last couple of sessions, and it looks like things might be primed for this upcoming session starting in 2023. And the work that we were planning to do to support folks in Oregon, which we're going to do in a different way, we're also looking at partnering with folks in Washington State to see about whether they're ready to implement a permit to purchase law.
Any last thoughts for us?
So I have to say, I'm really excited about the success that we've had with Measure 114, not just because I think this is a strong evidence-based policy that will help folks and will really be a life-saving tool in Oregon, but also it was one of the first times our center, our newly formed center, has come together and done this effective translation. For me, a core component of public health is about taking the research and advocating for the changes that we know are going to save lives. And so we have some of the best gun violence prevention researchers in the country. We've got some of the best advocates in the country who are coming together and really taking the best available data and evidence and turning it into something actionable, giving people concrete recommendations. And so for me, it's exciting to see the changes now. Right? This is not about 50 years from now, although I certainly hope these laws are still in place doing good work. But right now, we are seeing the changes that we know need to happen. And that is really inspiring for me.
Again, this is a huge victory, and we thank you so much for all of your efforts and research behind this. And we will be checking in with you to see how these additional initiatives go. So thank you so much for joining us.
Thanks for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.